This Saturday is continuing to strike targets across Lebanon, including an apartment building in a densely populated northern Beirut suburb that had also been struck a day earlier. Lebanese health authorities also reporting that an overnight Israeli strike killed a dozen medical staff at a clinic in the south of the country. On a visit to Lebanon that began on Friday, UN Chief Antonio Guterres calling on Israel and the Iran-backed Hezbollah militant group to stop the war. He also launched a $325 million humanitarian appeal to support Lebanon, where hundreds of thousands of people have now been displaced. Let's hear from some Beirut residents.
I was woken up at 4 a.m. yesterday and I heard the sound of a drone really close. And at 4:40 a.m. there was a strong explosion. The dust and rocks landed on our balcony. It was big, and today the same thing.
Now we're really scared. There's no safety. You don't even know if you can go out for a short trip safely because you don't know where the next strike will hit. I'm sleeping in my car with my daughter and granddaughter because we're so scared. It's better to sleep in the car instead of getting hit by debris like this.
Well, for more, we can cross now to Beirut to speak with Dr. Shawky Amine Eddine, Humanitarian Affairs Coordinator at the International Committee of the Red Cross. Thank you very much for speaking to us here on Around the World today. The humanitarian crisis in Lebanon is worsening by the day. I don't need to tell you that. Could you start by giving us an account of the human cost of Israel's latest war against Hezbollah for the people of Lebanon?
Thank you for having me. Look, the humanitarian situation is very concerning. The things that we are seeing in Lebanon are heartbreaking. Over the past few days, over 830,000 people have been displaced from their houses. Many of these people are being displaced for the second and third time in less than 2 years. Among these are children, elderly people, people with disabilities, who are really struggling sometimes to find shelter and to find places where they can stay. Many of those people had to evacuate their houses due to the hostilities and after the issuing of evacuation orders overnight. Many of them fled their houses on foot. Many of them closed doors of houses that they're not sure they're going to be able to return to. Even if you go now around Beirut, around the seaside, you can see people sleeping under the skies at times when the temperature is dropping below 10 degrees at night, at times when we're still having rain and windy weather in Beirut. This situation is even becoming worse by the day as more people are having to evacuate their houses. Many of those people are accommodated in schools where classrooms had to stop. Instead of being in their houses, they are gathering and forced to move together in cramped schools. And on top of this, the number of injuries and fatalities has increased significantly. So up until yesterday, the hostilities have resulted in over 770 fatalities and over 1,900 injuries.
And what are the major challenges that you're encountering when it comes to supporting these hundreds of thousands of displaced people?
To start with, the humanitarian needs are massive. And it's impossible for one actor or one agency to be able to respond to the needs. We at the International Committee of the Red Cross, and we're working very closely with our partners, including a key partner, the Lebanese Red Cross, who is providing an amazing kind of services. They're providing emergency medical services and transportation of the sick and injured, blood services, and in terms of provision of blood units, and also a lot of relief items. We at the International Committee of the Red Cross have identified 3 priorities for our response. Our first priority is to protect the civilian population by engaging with the parties to the conflict to promote the respect for international humanitarian law. Our second priority is to assist and help the people who have been affected by the conflict, especially in those hard-to-reach areas, so that they can have access to essential services, including water, hygiene, food, shelter, like all the main things, mattresses, blankets. And our third priority is to assist the healthcare system in Lebanon so that those who are wounded as a result of the ongoing hostilities can receive quality medical and surgical care.
And what are you finding the hardest to implement sufficiently right now? Where are you struggling?
Look, the hostilities again are increasing and on daily basis. More people are being affected. For us as the International Committee of the Red Cross, we are trying to maintain proximity to the people who are mostly affected by the conflict. So we have a team specifically in the south, visiting the hospitals in the south where the hostilities are actually taking place in order to ensure that people still have access to the essential services. So one of the main things that we struggle and all actors in Lebanon struggle with is actually being able to do enough. As I mentioned earlier, the needs are immense. The humanitarian situation is dire. And it's very challenging for one organization or one agency to be able to cover all the needs. We are coordinating with the different actors. We are coordinating with the authorities, with other humanitarian agencies, with partners, including movement, Red Cross, Red Crescent movement partners in Lebanon, like the Lebanese Red Cross, as I mentioned earlier, in order to ensure complementarity and avoid duplication. But I keep on repeating, the needs are huge. The needs are immense. Shelters are operating at almost 98% capacities. People are having to move all the way from the south, all the way to the north to even find a single shelters. Many people are deciding not to go to shelters and to stay in the roads to sleep in their cars because they have to travel huge amounts, large amounts, many kilometers just to find a shelter.
Now, we're reporting today that an overnight Israeli strike killed a dozen medical staff at a clinic in southern Lebanon. Before getting your insights on the impact of that attack, let's hear now from Mohammed Noor El-Din, mayor of Burj Kalawiya, where the medical centre was hit.
This center had been providing services to more than 17,000 patients and had made great efforts under these difficult circumstances. A volunteer team worked at the center providing services to civilian patients, and the staff were also civilians.
Now, this appears to be a tragic attack. What more can you tell us about that strike and also its intended targets?
I'm not in a position to tell you more about the strike, but what I can tell you is that humanitarian and medical personnel risk their lives on a daily basis to be able to assist the wounded and to be able to support the people that are mostly affected by the conflict. These people, the paramedics, the doctors, the nurses, they should be able to carry out this mission without fearing for their own lives. No doctor, no nurse, no paramedic should be in a position whereby they have to worry about their own life while trying to save the lives of others. And the international humanitarian law is very clear. Under the international humanitarian law, hospitals, medical personnel, medical transport units, including ambulances that are used specifically for medical purposes are protected. They should not be targeted. So once again, on behalf of the International Committee of the Red Cross, we call again on all parties to the conflict to respect their obligations under international humanitarian law and to provide to spare these medical missions from the hostilities and from the violence.
Now, the answer to this may seem obvious, but I want to ask you nonetheless, just how concerned are you by the increasingly widening scope of Israel's operations in Lebanon?
Any conflict that happens in any place is concerning because, unfortunately, whenever you have conflict, whenever you have rounds of violence, the people who suffer the most, those who pay the highest price, are the civilian population. That's why, as the ICRC, we urge all parties to the conflict to prioritize de-escalation as a matter of urgency. the communities in Lebanon should not suffer and cannot endure another cycle of violence. The population here have suffered enough, especially that these hostilities come after rounds and rounds of compounded crisis that they have been going through.
Now, this war, of course, is just one of a handful of major conflicts globally that rely heavily on NGOs to take care of civilian populations. Do you, at the International Committee of the Red Cross, do you have enough money to do the work that needs to be done in Lebanon right now?
So the International Committee of the Red Cross has already been working on a contingency plan since the ceasefire after the last escalation of conflict in Lebanon. Following the recent escalation of conflict, we have activated our contingency plan. We have proceeded with our response plan. We have also considered additional budget requests from headquarters in order to support the response of the ICRC in Lebanon and in order to ensure the continuity of our operations in Lebanon.
Dr. Shawky Amine Eddine, Humanitarian Affairs Coordinator at the International Committee of the Red Cross in Beirut. Thank you very much for speaking to us here on France 24 today.